10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
Once you choose hope, anything is possible. Hello everyone, this is your host Ritu. Welcome back to BubbleChat Season 2. कैंसर के नाम से हर कोई डरता है. तो आज हमारे साथ डॉक्टर अंकुर बहल, द प्रिंसिपल डायरेक्टर ऑफ फोर्टिस गुड़गांव, जो कि आज हमारे साथ हैं, द सीनियर ऑन्कोलॉजिस्ट, जिस पर हम आज चर्चा करने वाले हैं. वेलकम डॉक्टर अंकुर.
थैंक यू रितु.
ग्रेट. और हमारे साथ हैं मिस्टर वरुण सूरी. He is the director, Morepen RX, Gub, and Generica, and Dr. Morepen. Welcome, Mr. Varun Suri.
Thank you. Thank you. Thank you, everyone.
Amazing. So आज का टॉपिक बहुत खास है, बहुत इम्पॉर्टेंट है, बिकॉज इस नाम से ही हर किसी को डर लगता है. तो क्यों ना इसके बारे में आज कुछ बातें, कुछ डिस्कशंस, और इतने सीनियर डॉक्टर के साथ आज हम बैठे हैं, तो इतने इंपॉर्टेंट टिप्स आपको मिलने वाले हैं जो कि आपको डॉक्टर्स के पास जाके भी इतनी सारी चीज़ें नहीं मिलने वाली हैं जो आज यहाँ मिलने वाली हैं. सो आज हम आपसे ये जानना चाहते हैं डॉक्टर साहब कि आपकी जर्नी कैसी रही. आप ऑन्कोलॉजिस्ट में और कैंसर जैसा आपने कैसे चूज़ कर लिया कि आप कैंसर के लिए आप पेशेंट्स को हेल्प करेंगे.
नमस्कार. ये क्वेश्चन आज तक किसी ने मुझसे पूछा नहीं है कि हाउ आई बिकेम एन ऑन्कोलॉजिस्ट. So it was personal that somebody in the family had cancer 2002 when I was assistant professor of medicine in Maulana Azad Medical College. Then I shifted gears. I went to oncology, and I still remember my father saying at that point of time that who takes oncology? You should have taken cardiology, gastroenterology, nephrology, kidney ka specialist, पेट का डॉक्टर, दिमाग का, नस का, heart attack. Why are you choosing cancer? So and I said no, it's a personal decision, but seeing the trend in those years, now it is the most common cause, second most common cause of death in our country. Every family has one. In those days, cancer was equivalent to a death sentence. Nobody, people used to be like shying away from an oncologist, not even from the patient. It was a taboo at that, I'm talking 25 years back. Now it is acceptance. You spoke बहुत important और खास बीमारी है. I say it is the commonest disease to have. Everybody has one person which is so important to him or her who is suffering and who has survived this disease. So it is the common thing to have, and people are tuned, communities tuned, and if you see Suri Saab and Ankur Bahl, the first thing which will come is कि chemotherapy तो नहीं ले रहे दोनों. They don't have hair on their head. So it is common, accepted, and now we have survivors. So I became an oncologist 20 years back. Because somebody was there in the family and there were no means. We used to have 2-3 hospitals in the metropolitan Delhi, and there was one Tata and one Safdarjung and at AIMS. I could sense the trend 20 years back, and now my father says that my son should also be an oncologist because he is feeling that burden of the disease. When he feel proud that I'm a doctor and oncologist, but he also feel proud that something is being done for this disease which was equivalent to death sentence 20 years back.
Absolutely.
Yeah.
That deserves a big round of applause, I think. So we want to welcome you once again.
Thank
we
you.
are very, very happy that you are here for our team in the head office. You are live on YouTube where the people in the plants can see you, people in the field can see you. And we'll make sure that the learnings today don't just stay with us, but they actually get spread to the whole community, to the families and society.
It should get spread. We should have a fear, but we should have an ease down approach towards this disease as well.
Very important.
No
yes.
panic, but please pursue it.
We have to be careful about the disease, but we don't have to fear the disease no more. So, sir, one first question from my side. We wanted to know that what are the most common cancers now in India among the men and among women, and are they different from what is happening across the world, or it's the same?
Yeah. So there are three questions here. What is the most common cancer? So most common cancer in our country is still head and neck, oral cavity, tongue, buccal mucosa. Breast cancer is going to be the number one cancer. Lung cancer is another thing which is going to be if not one, then number two. So head and neck cancer, breast cancer, lung cancer, and cervical cancer. So these cancers are sex specific, male or female. And in country like ours is a diverse country. So we have seen our trends and we have published our trend that the cancer in eastern part of Uttar Pradesh, central part of Uttar Pradesh, Delhi, and central India is something different. The gallbladder cancer this month is a gallbladder cancer awareness month. So we see the trends of gallbladder cancer along the Ganges River. Gallbladder cancer down south is rarity. Head and neck cancer in extreme part of India, which is Jammu and Kashmir, is rarity. So overall, if we have to say that head and neck cancer is the most common cancer, lung cancer in males is the most common cancer, and in females, breast and cervical cancer are the most common one everywhere. Worldwide also. So our trends, Indian trends, are different from the world trend. What we see in India, it's rare in some part of the western part or in the European part. Head and neck cancer, tobacco related, is rare there. Lung cancer is more commoner there. Breast cancer is more commoner there. But India is coming up. As the GDP is coming up, our trends are getting a par with the Western population as well. But Indian cancer and Western and European cancers are totally different. Our trends are different from rest of the world.
Right. So कैंसर के वर्ड से सब लोग डरते हैं. सो कैंसर है क्या? अगर बेसिक मैं आपसे ये पूछूं कि कैंसर लोगों को नाम से ही डरा देता है, सो कैंसर है क्या?
देखिए, कैंसर अगर बहुत ही इजीली वर्ड्स में एक्सप्लेन करना चाहूँ तो ये वो खराब सेल हैं जो इकट्ठे हो जाते हैं विद एजिंग. सो एज वी एज हमारे सेल म्यूटेट होके खराब सेल बन जाते हैं और बॉडी की इम्यूनिटी उन खराब सेल को बॉडी से निकाल देती है. बट विद एजिंग एंड विद इम्यूनोकॉम्प्रोमाइज स्टेट एंड विद स्मोकिंग एंड लॉट्स ऑफ अल्कोहल एंड रिस्क फैक्टर्स एंड ओबेसिटीज एंड डायबिटीज अराउंड अस, the immunity of the body gets weakened. So now our normal immune system is not able to kick those bad cells, and these bad cells accumulate in lung to form it lung cancer, accumulate in breast to form a breast cancer or a tongue cancer or a brain cancer. Cancer can happen in any organ of the body. So accumulation of bad cell which is not thrown away by the immunity of our body is cancer, and when it travels from one organ to another, it becomes stage 2, stage 3, stage 4.
स्टेज 4 पे काफ़ी लोगों को पता चलता है कि स्टेज 4 पे पहुंच गए हैं, लास्ट स्टेज पे, बट उससे पहले नहीं पता चलता है. What is the reason behind?
Majority of our population comes in 75 to 80% of our patients are coming in stage 4. I would say 10 to 15% are coming in, or maybe 20% are coming in stage 3. Very few patients are coming to us in stage 1. The reason behind this is acceptance to this disease and prevention for this disease. If somebody in my family is 60 years of age and she's a female, has she underwent 20 mammograms till now? You have to, everybody here has to ask this question for our families, for our mothers and sisters. Do they do annual mammogram after 40? The answer will be no. My next question is, do you do insurance of your car every year? The answer will be yes. A policeman on a red light, he asks for, what does he ask? He asks for a pollution, he asks for insurance of a car. He never asks whether people sitting in this car are insured for cancer. They have done screening for cancer. So our country, sorry to say that, our country is lacking in screening. We don't screen ourselves, but we have an audacity to ask okay, why people come in stage 4. You are not detecting, a normal detection is not happening. I can see there are many females over 40 years of age who have not undergone their mammogram, but they can ask why does stage 4 happens. We are not taking care of ourselves. We are taking care of our mobile phones, our cars, our carpets, our everything. If you buy a new iPhone, the first thing would you do is put a front cover and a back cover. For a 1 lakh rupees mobile phone, you are happy to invest 800 rupees on a back cover and a front cover, but you're not investing on yourself. The country is not investing in screening programs, so we cannot blame that country is seeing stage 4 cancers.
So, Dr. Bahl, very, very interesting thing that you mentioned, and what we would like you to inform us about is how the technology has developed in screening, and is it so easy to screen people, or even the latest of technology cannot help sometimes?
For screening, we don't need technology. Screening, the basics of screening is a disease can be picked up at an early stage with a test which is easily available. So government, the National Cancer Control Program, the cancer grids have been formed, the guidelines have been formed. I'm not here to teach guidelines for each and every cancer, but that if we talk about our female population, which is again 50% of our population, only 2 cancers can be screened, breast cancer and cervical cancer. The breast cancer screening starts with a mammography after 40 years of age. Self-breast examination starts after 20 years of age. Once you have achieved 40, then you should get a mammogram done once in 2 years. What is the cost of mammogram? The cost of mammogram is in best of best hospital or in a dispensary which is not having any technology is not more than 600 rupees.
Yeah.
600 rupees, and you change the cover of your mobile phone every year. You're not covering yourself, but you're changing the cover of your mobile phone.
These
600
mammographies are
rupees, safe, absolutely safe. And if the mammography detects breast cancer, it will be certainly stage 1. Everything can be done in 3-4 lakh rupees in best hospital. But once it reaches stage 4, then it cannot be cured, and you will be spending millions, cursing yourself, cursing the system. So screen, detect, and protect. So at Fortis, we have a campaign running, detect to protect. So we don't need a cauliflower growth in a breast. We need to detect one small 1 centimeter lump, which is not palpable, which can be picked up from a mammography. Stop giving gift to your mother and sisters and Masi and Bua on Rakhi and Tikka. Just give them a mammography coupon. If it be lying on your dining table, free of cost mammography coupon, that will be cost effective for your family. Instead of
So
giving,
I think the message is loud and clear.
That's very insightful, very insightful.
Instead of giving a Swarovski watch or a smart Apple phone, buy 500 coupons or 200 coupons or 20 coupons or 2 coupons for your family. Just keep it over a dining table. The lady will get it done.
Great.
Wow, good awareness
Yeah.
that it is easy, it is safe, and it can be done so conveniently.
I have done in my family. I have asked my Mamaji to cut down that 1,000 rupees on an annual Rakhi gift, give it a coupon of, which is, can be done everywhere down the street. Mammography can be done everywhere. There must be 100 centers in Gurgaon and 1,000 centers in Delhi who are, let's not talk about Gorakhpur. Let's not talk about Shimla. Talk about our own city. Just see a woman, ask her simply, Madam, mammography karaya if you're above 40. Answer will be no. At least she will think.
Yeah.
At least she will think why this man or my brother or my boyfriend or my husband has talked about this mammography.
And as you said, we can put the coupon in the phone cover.
Yes.
What about other cancers? They are also easily detectable, or you can figure out.
One success story in the country is cervical cancer. Yes. So cervical cancer was the most common cause of cancer-related death in women, and because of the successful Pap smear screening program for cervical cancer, the death has gone down drastically. And this year, Honorable Finance Minister Nirmala Sitharaman ji has also conveyed in his landmark speech that Indian health system will be incorporating cervical cancer vaccine in the National Cancer Immunization Program. Means we eradicated polio. Dr. Harshvardhan ji, so he started that Pulse Polio Abhiyan, the oral drops which were given, and polio is eradicated. Now cervical cancer vaccine, if it comes to the Indian National Cancer Immunization Program, it will be eradicated. The most common cause of death, cancer-related death in women, will be eradicated in next 30-40 years. What else you want? Screening of cervical cancer starts at an age of 35. A simple Pap smear test a lady should undergo. Take vaccine before marriage. You're rid of this disease.
Wow. Very nice. I think for women of our country, the two most important cancers, sir has given the way to detect it timely in stage 1 or stage 2. So very clear message that it's there. We just have to change our mindset. It's not about the technology. It's not about the pocket.
We don't need technology to screen. Simple test. A well-read basic doctor can do a Pap smear. A X-ray can do a mammography. 50% of your population is covered with most common cancer. If you talk about oncoeconomics, with screening, millions and trillions will be saved.
Absolutely.
So, number one thing, what अभी सबको बेसिकली मेमोग्राफी तो ज़रूर करवानी चाहिए बिकॉज ये तो बहुत बड़ा सर ने जो बताया है तो भी आज तक हमने भी इस चीज़ को बहुत लाइटली लिया सो नाउ दिस थिंग इज़ इन द माइंड एंड वी हैव टू गेट इट डन ASAP फर्स्ट थिंग सो डॉक्टर साहब व्हाट सिम्टम्स और साइंस शुड पीपल बी अवेयर ऑफ दैट मे इंडिकेट अ नीड दैट मेडिकल अटेंशन ड्यूरिंग ट्रीटमेंट
कि पिछले 10-15 सालों में ना आप में से हर कोई सुन चुका होगा कि कैंसर के लक्षण क्या है सबको रटे हुए हैं सिर्फ लेकिन वो घुस नहीं रहा दिमाग में इट्स नॉट एंटरिंग आवर ब्रेन दैट इफ यू आर लूजिंग वेट which you're not doing by dieting or exercise, if you're having fever, if you're having lumps in your body, if you're bleeding from in sputum, in your saliva or through vagina, irregular bowel habits, they all can be cancer. Everybody knows this. But my message to you is any disease which is not going away, any visit to a doctor which is not healing you, you're going from a same problem again and again to the doctor, whether it can be a back pain or a joint pain or a oral ulcer, stress ulcer, breathlessness, anything which is not getting resolved, please ask your doctor, can it be cancer? So any chronic symptom, whatever it is, can be cancer. Until and unless you ask for it and your general practitioner suspect it, you have to come out because your doctor, your general practitioner, the community, the mama, chacha, bade papa and all will say this is gas. Take Pantocid. Everything in our country is gas. Everything which is happening downstairs is piles. So these are two things which our chemist and which our community and we all are treating ourselves. But if gas is okay, if the gas doesn't go, if the piles doesn't go, any symptom which does not get heals in 4 to 6 weeks, think about this disease. Because if the symptoms are happening, then it is stage 3. If you're having a lump, if a lady can palpate a lump in an axilla and a breast, it is stage 3. If you're bleeding, it is stage 3. Stage 1 and 2 we can detect through screening program, but when symptomatology happens, if you're coughing blood, then it is stage 3 or 4. If it is coming on a plain X-ray, it is stage 4. So just seek help, do not shy. किसी को कुछ नहीं पड़ी किसी की, आप अपने बारे में ख्याल रखिए, डॉक्टर से बात करिए कि डॉक्टर साहब कैंसर तो नहीं हो सकता. He will be bound, your general practitioner will be bound to do tests which are essential. He will think beyond viral fever, piles, gas, the common things in life. But we shy asking our doctors, and doctors even shy to say it could be cancer. So conflict of interest should be taken away from the community. Think about this disease, accept it and move on.
I think a very, very valid point here, because we have seen a lot of times people either keep shying away from small ailments and until they become stage 4 kind of a scenario, and suddenly you hear that they were all fine and suddenly the cancer has come. But you are saying it's not the reality. Cancer always gives some indication.
Yes.
So one, you cannot ignore small problems or unexplained problems. And second very important point you're making is that it is about your health, and don't be shy to talk to your doctor about it. Even though that doctor might not be cancer specialist, then it becomes his obligation to dig deeper. Because sometimes we don't even tell everything to the doctor. We only tell them the main problem, not the history.
So many times we get females with breast cancer and they knew about this lump. That this lump is there for many months. And we ask, take a history. This is say, हमारे पास घर के आसपास कोई फीमेल डॉक्टर नहीं थी, या मुझे लगा ये ऐसे ही ठीक हो जाएगा. So there are some misconceptions in the community that cancer cannot happen to me. One misconception. Second misconception is that cancer means death. पहले तो मेरे को हो नहीं सकता, अगर हो गया तो मैं गई.
Yeah, two extremes.
Yes, two extremes. The community talks about extremes only.
तो सर, जब आपके पास ऐसे पेशेंट्स आते हैं कि कैंसर मींस डेथ और ये हो नहीं सकता, तब आप उस टाइम पे उनके साथ कैसे?
मैं तो I just say 3 words: do not die before your death.
Very nice.
Do not die before you die.
मरने से पहले हमें नहीं मरना है. We have to face it.
मरना तो एक सच है. It's not that
everyone
you die only of cancer.
Yeah.
So people have died in world because of cancer? No. So death happens because of organ failure. It could be a heart, it could be kidney, it could be liver, it could be brain. But we have to fight this disease, and oncologists all over the world are now relying on their survivors. If I open my contact list and if I type breast cancer, I would be having a list of 1,000 patients. And these are near dear to me, they are my survivors, and we get them grouped together. We do a survival meet every 3-6 monthly and ask new patient to talk about from the survivors. Survival will tell the story. Survival will say that I was being diagnosed with breast cancer 10 years back, I got this much treated and now I'm fine. So first of all, we have to protect, we have to screen, we have to detect. If detected, we have to treat it bravely, with the guidelines, and oncology in India is a par with Western oncology.
Okay.
एक ज़माना था वो पिक्चरों में ही होता था कि अमेरिका गए या स्लोन केटरिंग गए या एमडी एंडरसन गए. Everything is possible in this world, and we are at par with all the technology, from basics to advanced, from simple tablet chemotherapy to advanced immunotherapy. So everything is there. Just rely on your doctor, rely on your health system, and do not shy. That's the message.
Yeah, I think just today I read in Economic Times that Indian scientists are now working on some new novel technologies on oncology in cancer. So if we can have a COVID vaccine well on time, why can't we also be leaders in
Absolutely.
oncology?
But this is a team approach, where community also it's not only the doctors and oncologists will do. A normal healthcare worker, every literate person has to be this cancer healer, and he has to at least pass on the message that at least do tests which are required at your age and at your sex, and then maintain that balanced diet, exercise, omit obesity, sober culture, will be able to fight this disease well.
Could you just, you've busted many myths already, but any other common myths that you see in cancer that people talk about, and what are the things to take care of to avoid, cancer in the first phase?
The most important myth, one myth is that it cannot happen to me. Second is, if it happens to me, I'll die soon.
Yeah.
The third myth, which is very important and running all over the society, is sugar and cancer. People feel that by consuming sugar, the cancer cell will consume sugar and it will grow.
Okay.
It's a super myth in the society. Many of our cancer patients are under the debt of this myth that we will not take white sugar, we will not take carbs, our cancer will be suppressed. It is a very important myth, not spoken about well. So I'm taking this opportunity to tell all my cancer patients that do not cut down your sugar. This is somebody is making you fool. Sugar does not cause increase in cancer.
Very important. The Instagram world and the
Yeah.
WhatsApp world says sugar is forever. But we need carbs, we need sugar to survive.
So we need three things to survive. One is carb, one is protein, one is fat. There is no fourth thing which is required. If we cut down our carb, the calories requirement in our body, which is, so once you take chemotherapy and once you take this cancer treatment, the requirement of energy of the body is increased. If you cut down carb drastically, you will suffer. Your own protein and fat will dissolve. Because body to survive needs minimum number of calories. If you're cutting down carbs, protein and fat of the body will autolyze and your immunity will get up.
Absolutely. Very simple, very well explained. So one related question, Indians, we have a lot of spices, we eat a lot of dahi, we eat a lot of curcumin. So what are the good things about Indian diet and what are the bad things about Indians related to cancer?
Yeah. So good thing about Indian diet is the consumption of probiotics. So whether it is North India, South India, eastern part or a western part, a curd or yogurt is a very important part. So that is responsible to maintain the gut microbiome. And it's proven well that gut microbiome strengthen your immunity well, and you don't, so it's what is cancer? Cancer is a disbalance between immunity and the bad cell. If you're maintaining your immunity well, then, so curd, yogurt milk is useless. Curd is very important. And coming down to the extremes of diet, which is spices and all, so it's well published in the literature that esophageal cancer is very high down south in Karnataka and Tamil Nadu state. Esophageal cancer is very common in northeastern states because of the consumption of smoked food. Down south because of the spices. Jammu and Kashmir because of the consumption of loon tea, noon chai. So our diets is very important in causing this cancer. And coming on to the central part, the Gurgaon part or the Delhi part, I can see that many of people in audience are overweight. So obesity leads to cancer. Obesity leads to breast cancer, endometrial cancer, prostate cancer, and bowel cancer. So cancer and diet are linked together. Balanced diet helps fighting that disease and creating our immunity. So we have to speak about balanced diet. We have to speak about obesity in our population. So diet and cancer are clearly linked, and extreme consumption of spices can lead to certain cancers.
Good to know, sir.
Right. So, how can people best cope up with emotional challenges when and maintain a positive outlook after receiving cancer diagnosis and who undergo treatment?
Cancer is not an individualistic disease, it's a social disease.
Correct.
Families are involved. The financial structure of a family goes like hell. And we talk about debt, we talk about taking loans, we talk about EMIs. So when a cancer patient comes to our OPD, it takes me at least 1.5 hours to assess financial status, emotional status, psychological status. At times, many families have money, but they do not have that psychological strength or the social support which a patient requires. The patient takes one chemotherapy to second chemotherapy, but the logistic support is not there. There's no emotions with the family. So every comprehensive cancer center, we have 4 psycho-oncologists with us.
Okay.
They are not doctors, they are not chemotherapists, they are not radiotherapists. They just stand by the patient midnight, 9:30 to prevent that impending doom. We have a onco financial counselor with us
Okay.
who tells us that how much will be spended, how much is required, what will be used, how much money will be consumed at end of life care, how much you have to save. At times people get emotional when cancer treatment is given. They डॉक्टर साहब कर दो, जो मर्जी करना है कर दो, सब कुछ लगा दो, बचा दो. But the patient comes to us in stage 4. We cannot cure this patient, so we don't want that all money should be drained in that patient and the people who are left behind should suffer. So this is very emotional aspect. Happens with 100% of our patients. We have to judge, analyze, give them a solution, and most important, your oncologist should be empathetic. He should have those emotions, he should feel that financial crunch. There should not be any conflict of interest when cancer treatment is to be done. And you rightly asked, it's a social disease and comes with a financial burden, comes with huge trauma, mental trauma to the patient. So we have to overcome and we have to strengthen our patients at how to, so there are many
Are there any supportive groups in India?
Yes, absolutely. So every city has. So I can, 3 days before, we had a Harley Davidson ride from Gurgaon to Amritsar.
Okay.
So it was by a hog group and 70 bike riders, 6 of them were my patients.
Oh, okay.
So we did an event with Sister Shivani ji with breast cancer survivors.
Okay.
We have our colon cancer support group. So a new patient of colon cancer or rectal cancer needs a bag in his stomach. He will not accept it until and unless he see 500 patients with a stoma, stool stoma in their abdomen wall, then they will accept. So once patient sees the survivors, once patient sees the success story, then the acceptance to that treatment and acceptance to spend that amount of money or acceptance to spend that amount of mental peace is there. Support groups makes a huge impact, and the first myth that cancer will lead to death is broken there.
Sir, would you say that when people have cancer, different people will react differently to the treatment, or is it the stage 1 versus stage 4 situation?
So stages are different. But if I have 5 patients with stage 4 cancer, all 5 of them have different needs. All 5 of them have different needs. I'm not talking about the oncology need, but all 5 of them, it's a human mind. All 5 minds are different. The touch base, the emotional support, the financial support, the dietary support, is all different in all these 5 patients. So we have to assess, your oncologist and the team at Comprehensive Cancer Center will assess who needs more time, who needs less time. So there are variations of that need and we have to assess that.
I think it's very interesting, you know, when people have diabetes, they know it's going to go for life, but they can be at home.
Yes.
When they have a cardiac problem, they know it's going to be a 3-hour treatment or a 2-day or a 5-day, you know, stay in the hospital. But when it comes to oncology, as you mentioned, there is stigma, there is family, there is society, there is money, there is stress, and then the doctors have to also manage all the situations, take care of the patient, take care of the family. It's a totally different disease as compared to any other disease, and it's going to continue for long term. The treatment needs a lot of patience.
Long treatment, chronic treatment, and we will have successes and failure in this period. So if a patient, stage 4 patient, who are stage 4 patients are living for years now, but to maintain that quality of life, a lot is needed. A lot is needed. Beyond money it is.
Yes. Could you just throw a little bit of light on, you know, relapses, how to avoid relapses, if there is a solution or if there is one way to talk, you know, explain that.
So,
and overall, once a cancer patient has been treated, what are the precautions he or she needs to take care of?
So when we treat stage 1 or 2 cancers, they get treated, they get surgeries done, chemotherapy is done. So then surveillance is very important. So that's also one kind of shyness that patient has. I have been detected with breast cancer, I got my mastectomy done, I got my chemotherapy done, it's over, done. So surveillance at regular intervals, surveillance at, so we call patient every 3 monthly once treatment is done. And they are not compliant at all many times. So we give them hormonal treatment or a pill to be taken. I cannot go and give pill to each and every patient every day. So compliance is required. So once you are done with your treatment, then still on, then you have to go to your doctors at regularly, 3 monthly, 6 monthly, whenever he calls you up. And one thing which we are forgetting is that consumption of that same carcinogenic agent. So I have been diagnosed with lung cancer, my surgery is done, chemotherapy is done, and then again I am smoking. Then again I am consuming that risk factor again. So compliance, listen to your doctor, be adherent to the treatment protocol, and stay away from that carcinogen which has caused the first cancer. The mantras to prevent relapse.
So, if I would like to ask that, how are the mindfulness or relaxation techniques for reducing stress, anxiety, how are they useful in cancer treatment?
A lot. So 20 years down the line, so this machine which we are carrying in our pocket might be responsible. The computer which are open every time might be responsible. So there are no stories behind right now. We don't have evidence right now that, but we have evidence that mindfulness, relaxing, giving up your stresses, giving at least 5 minutes to you every 3 hours. How many of you can switch off your mobile phone every 2 hours for 5 minutes? It will be an anxiety. So at 7 o'clock, before saying good morning to your peers and your wife and husband, you check your WhatsApp.
True.
And how many messages
Instagram
have come last night? How many notifications I have seen in my LinkedIn? How many Facebook people have liked my pictures? It's an obsession which leads to compulsion. Even on red light, you're checking your WhatsApp. While driving. So I can see motorcyclists on a two-wheeler replying to their WhatsApp messages.
I think if I say that the OCD, obsessive compulsive disorder, because of the social media, a lot of people are...
So it's buying your... So it's actually eating up your time.
Yeah.
So we have 24 hours. God has not made 28 hours to us. It's the number of hours in a day are not increasing, but the number of the consumption of those hours, the electronic hours, are increasing. So yes, mindfulness, relieving your stress, exercises, going to gym and not doing exercises. We're joining gym, but we are not doing exercises there. Coming in, just listening and asking a Bluetooth speaker and what music and all are playing, but we are not doing exercises. So going to parks, stretching yourself, seeing your diet, cutting down all those saturated and unsaturated fatty acids. How many of you understand what is obesity? Am I obese? Yes, I am obese. Are you obese? So cut down your obesity, make a balanced diet, de-stress yourself. These might bring down the burden of cancer in our country, which is going to be 1 in 9 human individuals is having cancer at this point of time in India. Already. 1 in 9 has cancer.
So, sir, as you mentioned that obesity, we've seen worldwide data shows that obesity is a very good, the indicator, or more obese people are getting cancer. Is stress also been proven now?
There are no studies at the parameters of stress, measurimeter of that stress. So we have to wait for a good number of positive studies which says that stress can lead to cancer. But how to measure that stress? Our country, I don't think that our country is at this point of time fulfilling that this population is having stress and this population, Gurgaon population, is going to have cancer 10 times higher than the Delhi population, because stress here is more or stress here is less. So this is a research question. Maybe we are having those index of measuring stress and then we can prove that stress is causing cancer. But yes, it is a well-known hypothesis at this point of time that extreme of stresses can lead to decrease in your immunity of the body, and that impairment of that immunity can lead to some cancer.
And you must be seeing that in your patients as well, who are having cancer, if they are prone to stress or they're...
Stressed patients do very badly.
Okay.
Very badly. If I have 100 patients who are overstressed and they are taking treatment, they will do very badly. That's why we say that psycho-oncologist. So I'm a medical oncologist who give chemotherapy, immunotherapy, but I have 3 people in my team who are just seeing the psychological part of cancer. They don't give any medicine, they give therapies, they train yourself, they give you tasks so that you don't think about your cancer.
What about their family members? See, if they are getting therapies and psychologically, but at the home, all are talking about negative things.
Caretakers.
Yeah.
Talking about caretakers.
Yes.
So I was telling you in the break when we were sitting that these caretakers are very important. At times, patient does very well, but we see that the caretaker is getting thinned and leaned out.
True.
Caretaker diet is not adequate. The patient diet might be adequate because everybody is after that patient, but because of the stress, financial, emotional, psychological, psychosexual, there are many aspects of that. So taking care of those caretaker is extreme important, and support groups. So if we have called 100 patients, so then two caretakers will come along with that patient. Okay. So that group will be 900. So there will be 600 caretakers and 200 patients. So caretaker is very important. We at times counsel them. At times हमें लग रहा होता है कि हम मरीज का इलाज नहीं कर रहे, caretaker का इलाज कर रहे हैं. So caretaker have their needs. We have to address those needs and a balance. So that's why oncology, everybody is talking about cancer, because these caretakers have a direct impact on survival of that patient. A good caretaker, well-read caretaker, who is taking care of himself as well as the patient, will will add on to that success story.
So, sir, for like you talked about financial planning as well, that sometimes people have to sell their houses or they have to take loans. Some people we all also know they leave their jobs to take care of their family member, or they move from one country to another to take care of their parents as soon as they hear the word cancer. So what is your suggestion on financial planning and this whole family thing when cancer is detected in a family?
So this is part of a counseling. So when a family is being detected to have that one person is having cancer in the family, it all depends upon the stage of that cancer. Early stage, where we have a chance of curing this patient around 70 to 80% of the time in Indian scenario, we counsel them in a way so that the fruitfulness of this treatment, if this, suppose a family member is being diagnosed with cancer who is just 42 years of age and stage 2. So investing in this patient is right. We should counsel them in a way that if we cure this patient, he has another 30 years to live.
Yes.
So that another 30 years, so whatever he will earn those 30 years can be taken care by this acute thing. But if a patient who has stage 4 cancer, by all means we know that the survival is not going to be beyond 6 to 9 months, then counseling, there's a 360-degree
Change.
different of that counseling. So we have to tell that don't be emotional. If you don't have that financial support, this is the bare minimum you should do. Because whatever you do, you give chemotherapy, immunotherapy in whatever means, whatever combination, that will give you a delta of few months only. For few months, I would not like to drain millions of this family. So it all depends, where is this patient being treated? Is it a comprehensive cancer center or not? Are you being treated at nursing home? So most important part is in any of the good institute, whether it is a government or a private, each patient goes through a multidisciplinary tumor board. In my hospital, I am not the only person who will take decision for this patient. A whole board will take. When a board sits, then the decisions are better. So you will stop me taking wrong decision and I'll stop her taking wrong decision. If we all three are deciding one problem, then the chances that we will take care of, so rational treatment should be done. Over enthusiastic treatment in oncology should not be done. Financial counseling and assessing the financial thing is very important. And we can find many youngsters here. Whenever you are doing your insurances,
I was about to ask, yes.
please read it. Because we have a habit of signing, clicking the that square box, I accept and I agree, and then move on and give that premium. Please read that all things have been taken care. You can get 3 stunts, you can get a CABG done, you can take cancer patients, you need a daycare or you need 20, because you're paying for that premium. Please see that the insurances or the corporate policies which are being given to you has that basic, minimal, adequate treatment. And there's no harm in taking advices. I think whenever you're taking an insurance, how many of time you have taken an insurance, you have not even consulted your general practitioner?
True.
The family physician who is standing by you is not even reading what are you insured for. So many times patients have a false belief in their mind that I have a 50 lakh insurance. I have 50 lakh. But when it comes to the treatment, the insurance company don't even give you a penny because there was a clause. There was a clause which you have signed 8 years back that we cannot give chemotherapy to this patient, and you have accepted it. So please read whatever you are signing. That's part of that financial.
Yeah. So I think one is that you need to have health insurance rather than having, FDs and LICs for your kids or for your retirement. We need to start young in cancer as well, because even though the treatments are getting better, but the occurrence of cancer is also increasing. So we need to have health insurance at early age and with carefully reading the conditions of the insurance that we have. Sir, one last question from my side. In kids, is the cancer growing, and what do you think are the main reasons, or still no one knows about it?
So 15th February, yesterday,
yes,
was Childhood Cancer Awareness Day. So we have Dr. Vikas Dua and Dr. Rahul Bhargav with us. And if you go to a government institute, a cancer institute, you will find that unfortunate to have these kids having cancer. Kids have cancer, but 80% of these cancers are curable. So kids have cancer and they do not have, so the trend of cancer is something else from the adults. So kids have blood cancers, kids have brain tumors, kids have lymphoma, leukemia, neuroblastoma. So there are many common, I'm not a pediatric oncologist, but yes, cancer centers across the country. So pediatric population, pediatric cancer patient accounts for not less than 15 to 20% of the cancer burden in any of the comprehensive cancer center. So kids have cancer, but they are curable in 80% of the time.
Awesome. So now we are almost at the end. So I would like to ask you कि आप सर क्या मैसेज देना चाहेंगे कि कैंसर का जो ये डर है सबके दिमाग से पहले तो वो निकले और क्या क्या प्रिकॉशंस एंड देन क्या टेस्ट करवाएं सो दैट कि आज से ही वो लोग अवेयर हो जाएं कि कैंसर इज द बिग बज़ वर्ड इतना बड़ा बनाया हुआ है सो उसको हम कैसे दूर करें?
I think I'll tell you very practical way. So I was involved in my initial years of practice. So when I'm still young, but when I was younger, so I used to go to schools. I used to go to 11th and 12th class schools because the first smoke in our hand starts from 11th class or 12th class. Peers. So it's a peer pressure. So anybody who smokes and who comes with cancer, there's a history of at least 25 years of smoking in our country. Smoking starts at the age of 18 and you have cancer at the age of 55 or 60. By that time you have smoked good 20-30 years. Nobody starts smoking at 30 years of age and nobody quits at 38. ऐसा कभी नहीं हुआ कि कोई 30 साल में शुरू करे और 35 साल में छोड़ दे, ऐसी कोई स्मोकिंग नहीं होती. It starts at teen and you quit by the age of 55 or 60. So I say very important, and you have to understand these next three words. Cancer cures smoking in my country. Smoking causes cancer? Yes or no?
Yes.
No.
Cancer cures smoking in my country. When we ask patient, कि सिगरेट कब छोड़ी, तो उनका जवाब आता है जब बायोप्सी की रिपोर्ट आई. अभी तक समझ नहीं आया होगा किसी को. स्मोकिंग कैंसर कॉज करता है, कैंसर स्मोकिंग को क्योर करता है. तो हमारे देश में ये स्थिति है कि अस्थमा होगा, सांस फूलेगा, हॉस्पिटल की इमरजेंसी में जाएंगे, या कैंसर होगा या हार्ट अटैक होगा, तब बीड़ी या सिगरेट या तंबाकू छूटेगा.
And the data also shows that, you know, people in the developed countries, they are reducing their cigarette smoking or tobacco.
Yes.
And India is growing.
Yes.
And
So
you
our
very
industry-
rightly mentioned the age,
Our
the
industry is
experimentation
growing.
age.
And yesterday I saw a very relevant reel where one ex-cricketer of the country was blaming 3 ex-cricketers of the country that it comes to those role models to advertise for a pan masala.
Yeah.
I hope without controversy.
Yeah.
So we have to see that these heroes or these cricketers or these pastry people are actually not consuming. They are just advertising.
True.
And our kids fall into trap. Our young population fall into trap. So if we cut down smoking, if we cut down the use of smokeless tobacco, which is pan, masala, kheni, zarda, and all those things, 50% of our population, our country economic burden will be taken care of. So अगर smoking सब छोड़ दें, बीच में आप you go to every corporate building
Downstairs.
has a panwadi.
In even here downstairs
You take
there's a-
breaks. People
Yeah, station.
they go out and take a break. Then they will take a break with this mobile. So, and you're talking about stress. So cut down your smoke, cut down your smokeless tobacco, cut down your stress, cut down your obesity, get screened for breast and cervical cancer, and get screened for male population. We talk about females only all the time. Nobody takes care of the male health. हमेशा female population की बात होती है. We don't talk about men health. So males also, those who are smoking still active, and they do not have a symptom, get an HRCT of the test, get your PSA test if you are urinating more in the night. So all these things, if we have to, हम फंसे हुए हैं अपने उसमें ही, और उस हम फिर then we give a solution कि हम stressed up हैं तो let's smoke, stressed up है तो आज Friday night, वो Friday night, Monday night, Tuesday night बन जाता है, और the carcinogens are getting accumulated in our body and we do not have a mechanism to de-stress ourselves, and then we are blaming that why do stage 3 and 4 come to us.
Yeah, I think also just like we say मुझे नहीं हो सकता, we also when we get into these bad habits, we think कि we will not get addicted. I am strong, maybe especially when people are young, they think कि I'm going to just try out, I'm just experimenting, I'm not going to get addicted. But addiction slowly within,
And there are
before you know it.
misconceptions with smoking. This is light, this is ultra light, this is E, this is vaping, hookah, flavored, non-flavored. And then we talk about AQI index of the country, AQI index of the city. So we are living in a double standard. We are leading a double standard examples. Population जब आज तक में आता है कि गुड़गांव का population आज ये है, but you are taking 5 cigarettes in a day.
Yeah.
The direct smoke you are taking, or a hookah, or a e-cigarette, or vaping, multifactorial.
Sure. So even beautiful session where we've not only come to know about cancer, but we've loved the way you explained things to us, raised the awareness. I will remember the phone cover example for sure. And I think we learned a lot of good things that hospitals are doing, and especially what Fortis is doing to take care of cancer patients. Because patient always thinks कि मैं कैसे hospital से बाहर निकलूं, you know, कब मेरा hospital जाना बंद हो. But so much is happening at the hospitals to take care of the patients, and of course they have to keep trying new, you know, therapies to take care of the patients. So I think a big round of applause for Dr. Bahl. थोड़ा और जोर से बनता है. Thank you so much to, you know, for explaining so simply. And he has come today also at the cost of his patients. He had OPD, but he had to come here to enlighten us. So I hope this enlightenment goes a long way. We can do 1 or 2 questions because sir has to go. We have a cancer survivor. Please, आइए मैम. मैम को माइक दे देंगे.
Yeah.
वो यादें ताजा होनी जरूरी हैं.
एक्चुअली मैं अभी
एक तो गलत वर्ड इन्होंने यूज किया. आप सर्वाइवर नहीं हैं, कोई कैंसर नहीं, आप हीलर हैं.
मैं अभी भी कैसे डॉक्टर बोलते हैं कि टेस्ट करवा, मैं अभी भी इतनी डरती हूँ ना जाने के लिए, कहीं मुझे फिर से तो नहीं हो.
Relax.
अच्छा सर, क्वेश्चन मेरा ये है कि मेरी जो 2 बेटियाँ हैं, मैं उनके लिए क्या सिक्योर कर सकती हूँ. अभी वो 21 की है, तो वो बोलती है मेरे को कि मम्मी आप हमें कि वैक्सीनेशन लगवाओ, तो क्या ही कर ज़रूरी है?
बहुत ज़रूरी है. आपकी
किस एज में?
9 to 26. 9 to 26 is an age, basically 9 to till you get married. So cervical cancer vaccine, 2 shots, आपको 98% बचाता है इस बीमारी से.
अच्छा सर, तो ये मतलब कि सिर्फ यही मतलब कि वैक्सीनेशन सर्वाइकल कैंसर की ही वैक्सीनेशन जरूरी है?
सर्वाइकल कैंसर वैक्सीनेशन और सेल्फ, आपने बेटियों की बात करी.
मेरे को ब्रेस्ट कैंसर था.
हाँ जी, तो आपकी सेल्फ ब्रेस्ट एग्जामिनेशन आपकी बिटिया का.
हाँ जी.
40 साल की एज तक, 40 साल के बाद मैमोग्राफी, और आपको जिस एज पे हुआ था, सो वी हैव जेनेटिक काउंसलर्स. So we have genetic oncology counselors who sees what is the permutation, what is the risk factor, and how much this risk factor can attribute, and what should we do. So we have a specific department. आप कभी भी किसी भी सेंटर में,
बालाजी कैंसर हॉस्पिटल में हुआ था.
So किसी भी सेंटर में ये जेनेटिक काउंसलर्स अवेलेबल हैं, फ़ोन पे अवेलेबल हैं, वीडियो कॉल पे अवेलेबल हैं, और ऐसे बहुत सारे ऐप्स हैं जहाँ पे आपकी बेटियाँ जा सकती हैं और देख सकती हैं कि उनको रिस्क कितना है. वी हैव कैलकुलेटर्स टू इट.
अच्छा सर, ये क्या कहते हैं कि जैसे कई लोग ना डरा भी देते हो, कई जगह मैंने सुना भी, मेरे फ्रेंड सर्कल में भी था कि उनको भी जैसे ब्रेस्ट कैंसर था, क्योर हो गया, उसके बाद फिर से उनको बेचारी को हो गया एंड नाउ इज नो मोर।
तो एक बहुत ही आसान इसका जवाब है, कुछ तो लोग कहेंगे, लोगों का काम है
कहना।
कहना। तो ये लोग कौन है? ये हमें फ्री की एडवाइजेस देते रहते हैं। जब
यार,
हर
मेरे मोरपेन ने बहुत ही मेरा साथ दिया सर, उन दिनों बहुत साथ दिया।
this is also a misconception. We have advisors on this subject everywhere. So we have to pick and choose the right advisor. ये इतनी अंधविश्वास फैलाई जाती है ना, वो कहते हैं, वो कौन है? वो आते नहीं कर सब, वो सब कुछ बताते हैं। वो हमें ये भी बताते हैं एप्पल का फ़ोन लेना है, सैमसंग का नहीं लेना, हनीमून मालदीव्स में मनाना है, बाली में नहीं मनाना, उनको सब कुछ पता है। तो जो एडवाइजर्स हैं ना हमारे कम्युनिटी में, उनको भी रिस्पॉन्सिबल होना पड़ेगा। हम हर एक चीज़ की एडवाइस दे सकते हैं आज की डेट में। ये क्लार्क्स का शूज़ लेना है या मेट्रो का, स्केचर्स का लेना है या नाइकी का, हमें इतनी नॉलेज नहीं है, कम्युनिटी को इतनी नॉलेज नहीं है। प्लीज़ फॉर गॉड सेक स्टॉप गिविंग एडवाइजेस विच यू डोंट नो। वो कहते हैं ना, आप हर बंदा यही कहता है, वो कहते हैं कि वह फैल जाएगा, उनको पता ही नहीं है। वो तो मोरपेन में ग्लूकोमीटर बनाते हैं,
लेकिन सर
वो इंडिगो की फ्लाइट नहीं चला सकते।
आई रियली थैंक्स फॉर सुमित भटनागर।
सो अपने हेल्थ सिस्टम को ट्रस्ट करिए। आप सब लोग फ्लाइट पे बैठे हैं, आपको पता भी नहीं कि वो पायलट का नाम क्या था। आपने इंडिगो को ट्रस्ट किया, इंडियन एयरलाइंस को ट्रस्ट किया, स्पाइस जेट को ट्रस्ट किया, आपको पता भी नहीं है कि वो मशीन कौन चला रहा है। यू ट्रस्टेड एन institution for a 3 hours flight to Mumbai and we know that crash will lead to death.
100%.
So please trust your system. Indian system इतना trustable बन गया है। जाइए अपने डॉक्टर से सवाल पूछिए, खुल के पूछिए। हर एक जगह पे लोग हैं, बट वो कहते हैं उन्होंने ये सलाह दी थी, इस ट्रैप से बाहर निकल जाइए।
नहीं, इस मामले में तो मैं थैंक्स टू सुमित भटनागर, मेरे बॉस हैं, उन्होंने मेरा बहुत साथ दिया। और मुझे, मैं बोलती थी कि नहीं ऐसा को, कहते नहीं तू गलत है, तूने ऑफिस आने, मुझे मेंटली प्रिपेयर करा सर।
So right advice by right people we require.
Anyone having question, please come. Any more questions, please? No? All right. You have question? Please come.
कोविड के टाइम पे स्टेरॉइड्स बहुत लिए थे और आजकल लोगों को कैंसर हो गया, किसी को अटैक हो गया, तो मतलब वही लोग वाली बात आ गई।
आप वही बात सही कह रहे हैं कि कोविड स्टेरॉइड्स क्या है? स्टेरॉइड एक इम्यूनो सप्रेसेंट है। आपने बहुत टाइम के लिए स्टेरॉइड लिया, वीडियो कॉल्स पे स्टेरॉइड लिए, फिर स्टेरॉइड ने आपकी इम्यूनिटी को कम कर दिया। देयर इज नो सच डायरेक्ट इम्पैक्ट ऑफ कंजम्पशन ऑफ स्टेरॉइड्स एंड हैपनिंग कैंसर आफ्टर 2 years 3 years, and whatever steroids the community took in COVID was for short term.
Yes.
For initial 2-3 weeks or 10 days or 12 days, the consumption of steroid and leading to cancer is not proven, and I don't think that consumption of that short steroids will be cancerous in nature in coming years.
Great. So it was a very very insightful session. Thank you, Dr. Bahl. And बहुत ही जल्दी मिलेंगे आपसे. Till then, take care. Bye bye.
Thank you.
Thank you. Thank you, sir, and thank you, everybody. Back to work and back to raising awareness.
कल सुबह मॉर्निंग वॉक पे जाते हैं और
Yes.
और हमें नहीं मिलना कभी। ऑन्कोलॉजिस्ट को नहीं मिलना, ऑन्कोलॉजिस्ट को जब मिलने का नहीं आना चाहिए मौका।
हम आपको कॉफी पे बुलाएंगे।
Thank you.
So please.